Good morning, Trinidad and Tobago, and thank you for joining us for another Ministry of Health virtual media conference on the national COVID-19 response, where we provide accurate, up-to-date and reliable information on the COVID-19 virus and vaccinations. Our panelists today are Dr. Avery Hines, Technical Director, Epidemiology Division, Ministry of Health, Dr. Emil Mohammed, Clinical Coordinator of the NWRHA COVID-19 Parallel Healthcare System, and Dr. Peggy Ann Registrar and COVID team member, Internal Medicine Department at the Couva Hospital and Multi-Training Facility. I am Al Alexander, Senior Corporate Communications Officer at the Ministry of Health, and your moderator for today's virtual media conference. Dr. Hines will begin with the latest clinical and epidemiological updates. Dr. Hines.
Thank you, Mr. Alexander. Good morning to my colleagues, Dr. Mohammed and Dr. Burgess. Good morning to members of the media and members of the viewing and listening public. If we can start with the first slide, we'll go directly into today's clinical update. And this data is as at Sunday, the 14th November 2021 at 4 p.m., at which time we had tested 413,488 samples at both public and private facilities. Of those, 62,267 cumulative positives have been identified. Of those positives, so far we have had 53,578 recoveries. We currently have a total of 5,980 persons in home self-isolation, 423 in hospitals, and 83 in step-down facilities, and those comprise the 6,831 total active positive cases, along with the 345 new positive cases that would have been identified yesterday. As at that date and time, we had accumulated 1,858 total COVID fatalities, and we extend our condolences to members of those bereaved families. Looking at the vaccination updates, we would note that individuals who had completed one dose, their first dose of a two-dose regimen, numbered 632,313 in total. Those who completed two doses, the second dose of their two-dose regimen, were 588,501, and those who had been vaccinated under the single-dose regimen of Johnson & Johnson were 38,686. So those who had completed their vaccination regimen currently number 627,187 individuals, and individuals who are eligible for an additional primary dose and who have taken up that opportunity currently number 3,559. Now, if we go directly into the epidemiological update, we will look at what we call the epi curve, the epidemic curve. And if we look to the right-hand side of that curve, we see that those dark green bars, which are the bars that represent the daily numbers for the month of November, those bars are considerably taller on average than the ones for the previous months being the fuchsia or pink being July, that indigo being August, the brown being September, and the light green being October. And alongside that, we see that the dotted line that runs through this graph, which is what we call the 7-day rolling average, that has taken an upward incline. We're seeing an increase in that rolling average, and this is something that we've been warning the population that we need to be concerned about, and we need to strengthen some of our adherence to the public health interventions, and of course continue to raise the population's vaccination level. If we go to the next slide, we see the same information now at the weekly timescale. So this data basically uses the same colors for the months, and you see the dark green colors showing each week for the month of November that's been completed so far, and we see that those bars got progressively taller. In fact, there was basically a 60% increase between the last completed week, which is week 45, and the previous week of week 44. We're currently in week 46 and looking at the pace at which we are currently proceeding, hoping that we don't again exceed the previous week's total. Against that backdrop, we have the peach-colored section, which shows us the percentage positivity, and that has risen from its sort of channel that it was hovering in between 25 and 30% to above 40%, and we are looking at that as well because that is a reflection although not a direct measurement, it is a reflection of the level of viral circulation in the population. As that goes up, we recognize that there are clearly more individuals in the population who are currently COVID positive. Moving to the next slide, we aggregate that data again to a monthly time scale, and we see that although we're only halfway through the month of November, we are really nearly already at the total for the month of October. So if we continue at this pace, we will have a November total that far exceeds the month of October and might rival June. And we're looking at the background again of the positivity, which has trended upwards and which remains higher than in the previous months. Again, indicating that we're seeing that increased level of circulation of the virus in the population, and therefore we need to have an increased level of care. Moving to the next slide, we note that the demographics haven't changed significantly. We still see the same basic age groups predominating in terms of the number of positives, where 51% fall within that 25 to 49-year-old age range, and we're just about 50-50 in terms of the male-female balance. Moving to the next, when we compare that with the fatalities, on the next slide, we see that the COVID-19 fatalities have been concentrated more in the age groups above 60. So about 2/3 of the deaths have occurred in that age group. But there are other factors which we keep reminding the population of. One is the fact that many of these individuals, vast majority, would have had pre-existing conditions, chronic conditions, which we have referred to as comorbidities, which reduce their body's ability to respond. Against that backdrop, we've also noted that individuals who have been vaccinated fare better than those who haven't, even among those with comorbidities. So we note that those who have not been vaccinated have been the majority of the deaths that have occurred since vaccination took hold, and we got a good level or a reasonable level of vaccination to manifest itself across the last several months. So we do want to encourage individuals, especially those in the vulnerable groups, vulnerable age group, vulnerable comorbidity group, to go ahead and access the vaccinations that are available at this point in time. Moving to the next slide, we look at the distribution of the cases over the last 2 weeks, and we see that there are areas on this map that are darkening. The darker colors represent larger numbers of cases in communities. And the trend that we're seeing is that where there are population centers, clearly we have more cases, but we're actually seeing some areas heat up more than others at this point in time. Moving to the next, if we look at that on a county level, we would note that looking at the purple bars or purple dots as the week 43 cases and the gold ones as week 44, we'd see that for the entire country, each county has noted an increase from the penultimate to the ultimate week on the map. So that, again, tracks with the overall increase in the number of cases that we've seen from 1 week to the next. And if you look at that over a slightly longer time scale, each group of bars here represents the number of cases by epi-week by county. And we see that each of the counties is now showing basically an upward trend over the last few weeks in the heights of those bars. So again, this is the background situation that we are referring to when we say that we do need to encourage the population to get vaccinated so that you reduce your risk of severe illness and death even if you do get infected. And we do also need to continue to adhere to those public health guidelines. The mask wearing, avoiding moving around and avoiding gatherings when you feel ill. Avoiding gatherings if you've been exposed to someone who is a confirmed case, even if you don't feel ill. Because there are, of course, some asymptomatic positives that are roaming around, but if you have been exposed, you're higher risk of being an infected case, and therefore the quarantine that we've been advocating since day one, that applies, and we need to continue to encourage persons who know they've been exposed not to move around when they're supposed to be quarantined, and those who feel unwell also please don't move around if you're having those respiratory symptoms. With that, I'm going to turn you back over to Mr. Alexander for the rest of the presentations this morning.
Thank you very much, Dr. Hines. And now, as Dr. Hines just pointed out, we are seeing an increase in cases and hospitalizations due to COVID. We now go to Dr. Burgess, who will share with us what is currently happening on the COVID-19 wards at the Couva Hospital.
Members of the panel, Dr. Avery Hines, Dr. Emil Mohammed, Mr. Al Alexander, members of the press, the listening and viewing audience, good morning. I am Dr. Peggy Ann Burgess, one of the medical registrars attached to the COVID-19 team at the Couva Hospital and Multi-Training Facility. I'm indeed grateful for this opportunity today, and I would like to share with you a bit of my journey and give you a snapshot of our daily experience. The entire world experienced a dramatic change on March 11, 2020, when COVID-19 was declared a pandemic by the World Health Organization. Never would we have known what we were about to experience. At the time, it seemed far away, for the first cluster of cases was identified in Wuhan, China, December 31st, 2019. I remember saying to myself, we have some time, Trinidad is far. And then on March 12, 2020, COVID-19 arrived on our shores. Little did we know that life was about to change in a dramatic way. It is intense, it is dynamic. Our days are filled with lots of activity focused on safe and efficient patient care. A huge team of personnel from various services are involved in the daily care of patients. Doctors, nurses, physiotherapists, patient escorts, radiologists, radiographers, dietitians, psychologists, medical social workers, housekeeping services, laboratory services, biomedical equipment technicians, the IT department, customer service representatives, engineering, OSHA, the administrative secretarial team, and security services. Every single team and service is important for the efficient functioning of this parallel healthcare system. We come every day with great anticipation to plan, strategize, and do our due diligence for that day. The structural setup within the parallel health system, hospital system, is divided into the cold zone and the hot zone. The cold zone, where we are out of PPE, is our strategic communication and planning area. We answer phones, prepare for our admissions, enter daily data, have assessment huddles or meetings so that our days can run with maximum efficiency. The hot zone is where we have all our warded, sick, positive, COVID-positive patients, where we must enter donned in our PPE, personal protective equipment, which serves to protect us from this deadly disease. The hot zone is an intensely emotional space. It is an uncomfortable place. It's a painful place, a sad place, a depressing place, an isolating place, and a scary place for the patient and sometimes for us. We may spend up to 6 hours or more in this space attending to patients, doing medical procedures, and ensuring that optimum care is being given. The feelings of despair and hopelessness lurk continuously as patients lay in their beds waiting to recover. The patients at our facility are very sick. They are varying age groups, young, old, middle-aged. Some have known multiple pre-existing conditions or comorbidities, while others have none and were otherwise in perfect health prior to contracting COVID-19. As you watch these patients struggle on in their illness, you sense the effects of isolation. There's fear, anxiety, depression, and extreme loneliness. Family members are unable to visit, and so patients depend on phone and video calls to stay in touch with their loved ones. This is very hard. We try our best to facilitate those who have no devices so they can hear their loved ones and their loved ones can hear them. While on my evening rounds last week, I met patient A, a 71-year-old male with comorbidities. As I walked up to his bedside, asking him how he was doing, he sat with his head hanging down, looking very sad. Mr. A had a tortuous journey. He had severe COVID disease, but he was fighting through. He was stepped down from the HDU and ICU and was now on the ward as we tried to gradually wean him off oxygen therapy. The loneliness affected him. He told me he missed his family, his wife, his children, his grandchildren. Even though he spoke to them daily, it was not the same. The tears flowed from his eyes. He had enough and just wanted to be home. I spent some time with him, just giving him the opportunity to share and then encouraging him, letting him know he was getting there and to keep the faith. As I continued my evening walkthrough, I went to the bed of patient M, one of our long-standing patients. He's a middle-aged male with comorbidities. His journey had been a tough one. Also stepped down and discharged from the HDU ICU. He was now drastically improved after focused and immediate intervention was given. While chatting with him, I could see the pictures of his family stuck around the bed. He cries and just shares his feelings. He's grateful to the team for serving him. He shares with me every day I'm praying, Doc, and asking God to take me back home to my family. He starts crying. I stand there listening, giving him the time he needs. I have some time to listen, as the sickest patients for the evening were already transferred to HDU. I can give him another few minutes so that he can just express and share how he feels. As a physician serving in this pandemic, the experience is heart-wrenching. We daily struggle to strike the balance of serving efficiently and dealing with the pain and depression that we sometimes face. It is extremely difficult to deal with sickness and death on a daily basis. Delivering bad news is tough, and doing it over the phone, where you are unable to connect with relatives, is even harder. The weeping and wailing of anxious, grieving relatives hurt to the core. This is very painful for me. But in the moment, all I can do is be strong, express my sincere condolences, and advise them on the next step. It is not easy. Ladies and gentlemen, this is just another side of the hot zone, the emotional side, and the daily experience that we face as frontliners. I must say, our mental health is affected daily. For me, as a faith-based physician, my dependence and trust in God has kept me standing. I'm able to overcome and see a glimmer of hope in the darkness due to the hope that God gives me. Psalm 23, a very popular passage, says, "Even though I walk through the valley of the shadow of death, I will fear no evil, for thou art with me." God has kept us, and God is still keeping us. At Couva, I am proud and happy to serve with a committed and resilient team of consultants, registrars, and house officers on the medical ward. We have toiled, and we continue to toil. We wake up every day, and we do it again. Yes, we are exhausted. We want the pandemic to end oh so badly. For this to happen, we need to work together as a team. We need you to work with us, Trinidad and Tobago. You do not ever want to experience this devastating disease and its many long-term complications. COVID is real. Don't believe that it isn't. And so this morning, I strongly plead with you and everyone today. Be responsible, be responsible, be responsible. Practice and uphold all public health guidelines efficiently. Please get vaccinated. Vaccines are a critical tool in the battle against COVID-19. Stop listening to conspiracy theories. Be informed and educate yourself by reading credible sources of information. We can do this together as a team, Trinidad and Tobago. Together, everyone achieves more. Thank you.
Thank you very much, Dr. Burgess. The Ministry of Health advises that an additional primary dose of the COVID-19 vaccine has been available for fully vaccinated elderly and immunocompromised persons since 10th November 2021. Dialysis patients are part of one such group of individuals that are encouraged to take that third primary dose of the COVID-19 vaccine. Here to tell you more on the importance of this vaccine to dialysis patients is Dr. Emil Mohammed. Good morning and welcome.
Thank you, everybody. Good morning to my panel, all courtesies observed. And I would like to thank you for the invitation to talk about dialysis and COVID. And I'm talking to you with my kidney specialist hat on this morning. I want to take you through a historical journey with COVID and dialysis, just like my colleague Dr. Burgess did. In February of 2020, one of the first deaths that was reported in the US was in fact a dialysis patient in his 50s. And we understood the potential catastrophe that COVID could cause to dialysis patients in our dialysis communities as early as then. And from March 2020, Trinidad, like the rest of the Western Hemisphere, were trying to put as many measures in place as we could to protect this vulnerable population. By about July of 2020, the information and the data started to come out. And a large study from the UK actually showed that if you had advanced chronic kidney disease or were a dialysis patient, you were more likely to die from COVID compared to all the other risk factors that we've heard about in the previous months, compared to obesity, diabetes, underlying lung disease. It really was devastating what COVID was doing to the dialysis and kidney population. By the end of 2020, we started to see studies from around the world, and we were getting a better handle on what COVID was doing to these dialysis patients. A large study from Europe had shown that the death rate within contracting COVID within 28 days for a dialysis or a transplant patient was upward of 25%. So that was the sort of background that we knew and we were experiencing here in Trinidad as well. What I want to do is I want to take you through our local data and what we have experienced in the last 6 months. Now, there are 3 dedicated hospitals or dialysis centers in the parallel healthcare system for confirmed COVID positive patients. They are based at Arima General Hospital, Couva, and the Augustus Long Hospital. Arima being the largest center that can facilitate the most number of dialysis patients. Within the last 6 months, from May to October, those 3 centers have accommodated 259 dialysis patients. Now, this number does not include the emergency patients who needed emergency dialysis in our ICUs and our HDUs. We use a specialized treatment called CRRT. This does not include that. The majority of these patients are our regular dialysis patients. And this information is extremely worrisome, because another piece of data that comes out of what we've been looking at is that of these 259 patients, 30.5% have died from COVID. So for a kidney or dialysis patient, the chances of dying of COVID is almost 1 in 3. That's how devastating it has been for our vulnerable dialysis populations. And there's something else that's very concerning from the data, and that's the sheer number and volume of dialysis patients who have had COVID in the last 6 months. Because the vast majority of those 259 patients were regular dialysis patients, and actually represents 14% of our total dialysis population. You must remember that dialysis patients can't lock down like the rest of us. They can't stay home like the rest of us. They have to travel. To some extent, they have to congregate. They have to interact with the people who provide their life-saving dialysis treatment. So the same rules don't apply for them. One of the problems that we have in Trinidad and Tobago is that far too many people who are dialyzing and on dialysis are not vaccinated. In 2021, we have had a lot more data that has shown us that there is benefit of dialyzing the immunocompromised. So in other words, a dialysis patient has a suppressed immune system, and that's one of the reasons that they're so vulnerable to COVID, and they benefit from vaccination. But lately, a lot of the information, a lot of the research, a lot of the data that we're getting is because their immune system is suppressed, they may not necessarily respond and generate the antibodies to a vaccine compared to the general population. And the research is leading us in a direction that shows us a third dose of your vaccine does improve your antibody levels, and does give you protection as a dialysis patient. So it's extremely important. I am asking patients with advanced chronic kidney disease, and I'm asking patients who are dialysis patients. In fact, I am asking on behalf of all the overwhelmed and exhausted doctors who look after these patients, if you are a dialysis patient, please go and get vaccinated. If you are a dialysis patient who has been vaccinated, please take up the offer of your third dose. It will give you additional protection. If you are a loved one, a family member, a friend of a dialysis patient, please go and get vaccinated. If you are the driver, if you are a healthcare worker, and you are around dialysis patients, please get vaccinated. It is extremely important at this juncture that we protect the most vulnerable in our society, and the dialysis patients, sadly, are top of that list of people that we need to protect. And I just want to make one more point, which is I'd like to thank all the dialysis units across this country for the hard work that they've done. But now is more important than ever that we continue to maintain our strictest standards and safety and infection and prevention control measures. Thank you for your time.
And thank you, Dr. Mohammed. We move to the question and answer segment of this morning's update. Our media representatives are reminded to please indicate your name and the media house that you represent before posing your questions. We ask for a maximum of two concise questions per media house in the first instance, and if time allows, we will facilitate an additional question. If we have limited time, we will ask for one brief question from the media representative moving forward. And our first question goes to Guardian Media Limited. Sorry, Power 102. Power 102.
Good morning, Sparkle McIntosh, Power 102 Digital. My question is for Dr. Hines. Dr. Hines, the Prime Minister on Saturday said more people come out of the ICU feet first, suggesting that the mortality rate is over 50%. Can the ministry officially confirm this, and what is the ICU mortality rate for each of the past 3 months? Thank you.
Okay, thank you for the question. As we've indicated before, because the actual denominator data is data that resides within the institutions, and it's a little bit more challenging than you'd expect to collect, we don't have a rate that we can share at a national level. That data would actually have to be physically collected and compiled. And while that process is ongoing, the people who have to do that are also the same ones that have to take care of the patients, because not anyone can just wander into the hospitals, into their hot zones where their notes are, to collect and collate this data. So there's a challenge in getting the denominators that would be required to share a rate with you. So at this point, no, this is not a question that we can give a figure to.
Thank you very much, Dr. Hines. We now go to Guardian Media Limited.
Hi, morning, everyone. Rashad Khan, Guardian Media Limited. Okay, so Dr. Hines, I was hoping for the minister to be here, but I'll still pose the question to you and hope that you could give an answer. When the Prime Minister spoke on Saturday, he did make mention that even though the state of emergency will be lifted later this week, that the public health regulations will still be used to an extent to manage the restrictions. Now, to what extent, I don't know if you'll be able to answer, is it going to be that we're going to revert to the previous version, or is anything going to be changed within that public health regulations to govern how people open their businesses or even adjust the fines? And my second question is, on social media, I saw that a young woman said her father was a fully vaccinated, healthy 59-year-old man, but still managed to pass away from COVID-19 at hospital. So I just wanted to get any updated figures on how many instances something like that has happened locally, and what is your advice to people who may be concerned about that news?
Okay, thank you for the two questions. I'll go backwards and answer the second one first. So, as we had promised, we said we'd want to try to update that particular figure by data as of Saturday. As at that point in time, we had noted and confirmed that among the 1,437 total fatalities that would have occurred since we began to count fatalities among vaccinated versus unvaccinated individuals, what we have noted is that 56 of those, which is about 3.8%, would have been individuals who had 2 doses of a vaccine on board more than 2 weeks after their vaccination regimen had been completed. So that's 3.8%, let's say 4% at most. So 96% of the fatalities that have continued to occur continue to be among the unvaccinated. Now, what we did also notice is that when the data is looked at in more detail, you see that most of the people who have these outcomes in spite of vaccination are individuals that had underlying conditions, usually already diagnosed underlying conditions that that would compromise their body's ability to respond. There are sometimes instances in which individuals do not know that they have an underlying condition, and we can't really account for exactly how many of those cases where unknown underlying conditions would have contributed to death there were. But what the advice would be to everyone is, yes, make sure to get vaccinated. Also, what we're noting is that in some cases, after individuals are diagnosed with COVID and they are deteriorating, there is still some hesitancy, for want of a better word, to actually access the healthcare system. So when an ambulance is called, there's hesitancy to use that service to go and get additional higher level care. So you want to encourage persons that when there is need to step up your care, that you do it as early as possible, as opposed to waiting until there is very little that can be done. So this is a trend that we noted. I think we'd spoken about it previously. And we do want to continue to encourage persons that if your status begins to change, if you start to feel more fatigued, more out of breath, if your SpO2, that oxygen saturation that you read on that finger monitor, if those levels drop to a place where the person in the healthcare individual monitoring your care says, listen, you need to go in, then the best advice is to follow the recommendations and go in for advanced care as quickly as possible. Now, the first question, I'll remind me the first question. The first question was...
Richard,
just remind me the first question.
Unmute.
Okay, thank you for unmuting me. All right. The first question is, when we revert to using the public health regulations to kind of guide restrictions during this period, is it going to have any changes such as opening times for businesses, increased fines, or anything like that, or we just kind of go with the same model that we've been using before?
So when the public health regulations become, again, the main driving force in trying to reduce risk, the decisions on what will change and what won't change will really be guided by what we're seeing happening with the figures, what we're seeing happening with incidents of clusters, etc. So it's going to be basically evidence-based, and the decisions, of course, will be made at the appropriate decision-making level. So it's going to be guided by how things are continuing to roll out in the absence of the SOE and with the adherence that we're seeing to those measures.
Thank you very much, Dr. Hines. We go to azpnews.com.
Good morning, Primary Harry, azpnews.com. I just wanted to follow up my first question on what Richard asked to Dr. Hines. Dr. Hines, can we get a further breakdown of the 56 people who had passed away out of the 1437 in terms of whether they had one vaccine, whether they had 2, and whether they contracted it after the 2 weeks or within the 2 weeks of the second vaccine? I don't know if you get a second breakdown of that. And my second question is for you again, Dr. Hines. In terms, I always ask about the contact tracing. So I just want to find out again, is there any difference now in the spreading of COVID-19 in terms of the contact tracing? Is there any specific event, or is it that because we have more more relaxation of measures, we find that people are gathering more and is spreading. And also people, they're suggesting that Trinidadians went to Miami Carnival recently and a lot of them returned, and that could be one of the events that is causing the super spreader. Is there any evidence of that? Thank you very much.
Okay, thanks for the questions. Now, thanks for allowing me to clarify. The 56 individuals that we are counting as fully vaccinated and having still contracted COVID-19 and passed on are individuals who would have had either 2 doses of a 2-dose regimen or 1 dose of the 1-dose regimen, and the time period of 2 weeks thereafter would have elapsed before the onset of the symptoms. So that's all of those would be, all of the 56 would be persons who met those criteria. And there have been 56 individuals in that grouping, the majority of whom have had known pre-existing comorbid conditions. With respect to the second, the contact tracing, what we did note in the contact tracing is that what we're seeing is much faster spread and much more complete secondary spread to the members of households, etc. Whereas in the earlies, we had seen that if individuals had been diagnosed and then followed the recommendations on isolation, we were seeing a greater level of success in preventing other members of the household from being infected. What we're seeing now is that entire households are being infected very rapidly. There may or may not be an interplay of 2 things. One is that clearly the Delta variant is much more transmissible. And then there may also be a little less stringency in some cases in terms of the isolation within the home. So we do want to encourage, where that may be the case, and it may not be in the majority of instances, but where that may be the case, we still do want to encourage members of a household who have one family member who has been confirmed. You do want to still try your best within your household to implement all of the isolation that would prevent everyone from getting ill at the same time, especially those members who are vulnerable, especially the older individuals, especially the children who would be vulnerable because they aren't vaccinated. So we still want to encourage that sort of that recommendation of isolation of those who are confirmed while the others quarantine and await further confirmation. Now, outside of that, with respect to the contact tracing, what we are seeing is really just the general movement of individuals. People have been out and about doing their normal routine daily activities. And where there's no specific activity that we're saying is contributing in largest to measure, the overall mobility that we're currently experiencing, because we've had all the relaxations, has of course contributed to the increase in the probability that an ill individual can come into contact with a susceptible one and pass illness on. So, I mean, that's what we've continued to see throughout.
Thank you very much, Dr. Hines. We now go to TTT. You're ready for your 2 questions.
Good morning, everyone. Kimberly D'Souza, TTT News. I have a question for Dr. Hines. Dr. Hines, I just wanted to know, how well the normal emergency care is working versus the parallel healthcare system. And I'm asking that question against the backdrop of a member from the public would have messaged us and said that she's hearing about a situation at the Eric Williams Medical Sciences Complex where there might be problems for children in the pediatric care to get attention that they need at this moment. Just wanted to know how well the parallel healthcare system is working against the normal emergency care system that's available. Thank you.
Okay, thank you for the question. Now, what we have been explaining, and what we'll explain again, is that the parallel healthcare system is really attempting, with all of the ramp-ups, with all of the expansions that we've been doing, we've been attempting to preserve the function of the traditional healthcare system. So while we would note that we would increase the ability of even the emergency rooms within the traditional healthcare system to provide higher level care to those who require COVID-19 management pending transfer, that activity is separate from the activity that would be engaged with children or adults seeking emergency care within the traditional healthcare system. So while we've said all of that, we do also want to maintain the message that our ability to continue to ramp up that care in response to demand is limited by resources. So at this point in time, we have across the healthcare system, in the traditional emergency rooms, the ability to provide ICU management and care, for example, for 18 individuals. And we are pending, at this point in time, we have the 57 total individuals who are pending transfer to the parallel healthcare system. But this is separate and apart from the care that is actually being provided to the members of the public who access the routine system. Yes, there are challenges with respect to volume, with respect to the ability to assign resources across the board, but those challenges are being met as quickly as possible, and they continue to attempt to maintain both systems separately without one compromising the other. So far, we've been moderately to largely successful in doing that.
Thank you very much, Dr. Hines. We go to TV6. Good morning.
Good morning, Urvashi from TV6. My questions are for Dr. Hines. Dr. Hines, we would have mentioned that most deaths occur in the elderly and also that most deaths are in the unvaccinated. Would it be correct to then assume that all persons are not being vaccinated, or at least not sufficiently vaccinated? And my second question, during your presentation on Saturday, Dr. Hines, I'm not sure if I would have missed it, but I was looking forward to seeing some projections in terms of infections, given that the rate seems to be very high now. Where do you think we stand to be next week? Over 1,000 cases? Do we stand to, break that record of daily infections? Thank you.
Okay, thanks for the question. So the answer to the first question is no. It's not that the elderly are insufficiently vaccinated in a special way, that the entire population has not yet optimized its vaccination status. And the elderly, of course, have additional vulnerabilities which concentrates the adverse outcomes in their age group. So we do want to point out again that if we look at the total number of cases, total number of individuals fully vaccinated, that's still not even a half of the vaccinatable or eligible population for vaccination. So you're going to have a significant number of individuals in all the age groups that continue to have that added vulnerability which they can fix. That added vulnerability meaning they're not vaccinated, but that can be fixed because vaccines are available. So we do want to encourage, yes, the elderly, but also everyone else who can access, who's eligible to access a vaccine, to do so, because that helps to protect everyone. And to answer the second question, yes, I believe you may have missed it, because we did show the overall direction in which the cumulative cases could go at the end of that presentation. While we didn't use numbers or numerical projections, looking at the end of this month, if we continue at the rate that we were going for the first couple of weeks in November, the possibility of getting to 1,000 cases a day is actually quite real. So we do want to encourage the population to put their own brakes on this by A, getting vaccinated, B, reducing unnecessary movement, C, adhering to the public health guidelines that advise individuals who are quarantined to remain in place at home, who are ill not to interact, who are ill also to go to the healthcare system to get their advanced care when needed, because these are the things that are going to put the brakes both on the new cases and on the adverse outcomes.
Thank you very much, Dr. Hines. And at this point, I want to encourage the media to also pose some questions to our other doctors who are here as well, and I'm more than versed to treat with some of the questions that you may have for us. Moving forward, we have AZP News for a follow-up question.
To follow up with Dr. Hines. Dr. Hines, has the contact tracing shown anybody who has been to Miami Carnival? Have they contracted COVID-19 or any of their primary or secondary contacts? Thank you.
Okay, so I think you're aware that when individuals return to the country or when they come into the country, part of the requirement is that they are COVID negative upon the purchase of their ticket and the preparation for boarding their flight. So there's the requirement for that COVID negative status 72 hours actually before they board the flight. So when individuals come back in, the vast majority of those who may have been infected would be filtered out. We did note that in the initial instances, we did see a couple cases that had come in and then noted that they were positive afterwards because they may have been incubating at the time. But it has not been shown to be a large driver of what we're seeing locally, and that's really just because the mechanisms for reducing the risk of individuals coming in infected, first, the vaccination requirement in order to avoid quarantine, and second, the negative PCR requirement, are things that then reduce the probability of an ill person coming down on the plane in the first place. So what we do note is that a lot of what we're seeing is that that local spread that is manifested worldwide with the Delta variant in particular. Once it enters the population, you're going to see that that particular variant become the dominant variant in a given time frame. And all the countries that have had Delta introduced have seen that similar sort of pattern, and that's to a large extent what we're experiencing at this point in time. And it is a contributor to the increase in the rates that we're seeing because it is a more transmissible variant.
Thank you very much, Dr. Hines. We go back to Guardian Media Limited for a follow-up question.
Hi, morning again, everyone. Dr. Hines, I just want to follow up on my second question that I asked there. Out of these 56 people who would have been fully vaccinated and unfortunately succumbed to COVID-19, do you all have any data on the vaccine types that they would have taken, the brands, and if there's a trend developing among any certain brands?
All right, thanks. I think that question was asked before, and what I pointed out at that time, I'll point out again. It's going to be misleading to try and look at the proportions of one vaccine or another among this small number and make any sort of correlations based on the fact that the majority of the vaccines that we have distributed have actually been one brand. So the probability of somebody then contracting COVID-19 having been vaccinated with that given brand is, of course, just naturally higher. And so too the probability of any other outcome. So it's not something that you can utilize to make a statement about the brands and the performance given the numbers that we have and the distribution of vaccines that we have within the population at this point in time.
Thank you, Dr. Hines. CL Communications, we are ready for your two questions.
Good morning, Natalie Singh, Caribbean Lifestyle Communications. I just have one minor question for Dr. Mohammed. I was wondering, what is the ministry doing when it comes to reaching out to these kidney patients and to actually sensitizing them even more, or providing the support for them to show them that the vaccine is a plus, like how you outlined it here today in the press conference? Thank you.
So that's an interesting question because it asks what the ministry is doing, but it's asking Dr. Mohammed. I don't know if he would want to respond to what the dialysis system is doing to encourage its patients directly. Let's phrase the question that way.
Thank you, Dr. Hines. So you may, when I had mentioned that when we knew about this COVID pandemic, we started to put measures in place. And one of the measures that we had put in place is we were educating the healthcare personnel that were involved with dialysis patients, and we were educating the dialysis patients. We did that through posters, through meetings, virtually, sharing of literature, and we continue with the education process. In fact, what we've been trying to do is even bring the vaccines to the dialysis units so that dialysis patients are actually very comfortable with being vaccinated at dialysis units. They get their hepatitis B vaccines done regularly, their influenza vaccines done, flu vaccines done regularly, and we're just trying to make the COVID vaccine just one of those additional vaccines that they get regularly. So at a dialysis unit level, we have constant education, constant updating, but you have to remember that we are the ones seeing these patients suffer and demise. So there's no sort of leniency. We don't really tend to drop the ball because we have to keep reinforcing. And right now, what we've been really trying to prioritize is a good number of our dialysis patients did get 2 vaccines, and we're really trying to prioritize that they need to get their 3rd dose because it will offer some additional protection. Thank you.
Thank you very much, Dr. Mohammed. We go to Newsday for your 2 questions.
Good day. Could somebody? Oh Lord, how do we? Hello.
Yes, we're hearing you. Please pose your questions.
Right. Good day. Sorry, I wasn't sure. Okay. First question is Dr. Burgess from the front line of CUVA. Are there any messages or lessons that Dr. Burgess would have learned from unvaccinated persons regarding vaccine hesitancy and their reasons for vaccine hesitancy that could possibly help craft a new strategy towards giving some sort of reassurance, bringing some meeting of the minds, and possibly even funded by US President Joe Biden had promised some millions of dollars for a new vaccine hesitancy initiative. So I wondered if Dr. Burgess had any lessons to share. The second thing is apparently the BBC is reporting today that Austria in Europe is putting the unvaccinated citizenry under a home lockdown. I wanted to get any reactions to that from the perspective of our culture here in Trinidad and Tobago and the possible risk of creating a greater problem of stigmatization, discrimination, and alienation. Thank you.
Thank you very much. We go to Dr. Burgess for the first question.
Thank you for that question. I think when we interact with patients, a lot of the times it has to do with a lot of fear. There's a lot of uncertainty. People just may not understand completely. And we may have people who may think, well, I have a strong immune system and I'm able to fight. And I think in these cases where we have to, it's important for us to continue to educate, and that is exactly what has been happening. And so when we interact with patients, we take the opportunity again to talk to them, to challenge them, to help them to understand, especially those who pulled through. You know, they put their entire perspective changes. And they really realize that, hey, this thing is real. But I think our main focus is to continue to encourage, to continue to educate in our communities, in our churches, all over. We have teachings and we do a lot of education, which will help the population a lot. Thank you.
Thank you. We go to Dr. Hines for the second question.
Okay, thank you for the second question. At present, the national approach to those who are currently unvaccinated is to continue to encourage them to become vaccinated. At any point that any different strategies or any changes in strategy are considered, those changes in strategy will be announced at the decision-maker level, either the level of the Prime Minister or the Minister of Health.
Thank you very much, Dr. Hines. We go back to TTT for a follow-up question.
Hi again, everyone. Kimberly D'Souza. Just a quick question for Dr. Mohammed. Dr. Mohammed, is it, can you just confirm for me, is it 259 patients you said would have contracted the virus? And is it 30.5% of them who would have died from the virus? And a follow-up question to Dr. Burgess. Dr. Burgess, I mean, the minister mentioned that a lot of
one question, please. Thank you. Dr. Mohammed?
Thank you for the question. Yes, it is 259 patients that have been dialyzed from May to October. So that's the time period from May to October. And the death rate was 30.5%. That is correct. I can give you more details in terms of the breakdown, but so 208 of the 259 were regular dialysis patients. The others were just about to need dialysis, but they were all considered stage 5 or advanced chronic kidney disease.
Thank you very much, Dr. Mohammed. We quickly go to TV6 for a follow-up question.
Thank you. Dr. Hines, in terms of daily COVID infections, what is the doubling time currently at? Thank you.
Okay, thanks for that. We're actually going to have to recalculate based on the last 2 weeks of data. So that is something that we will put into either a subsequent presentation, or we may put it onto the website. But thank you for the question.
All right, we're moving right on to AZP. AZP, we're ready for your follow-up question.
Thank you, Al. My question is for Dr. Peggy Ann Burgess. Dr. Burgess, do you see a stigmatization or within non-vaccinated patients by the healthcare staff? Is that a concern? That fully vaccinated patients are treated differently from those who are not fully vaccinated? Thank you.
Thank you for that question. We do not discriminate. We treat everybody with the maximum amount of treatment that is required, and that is something that has always been practiced and will continue to be practiced. Thank you.
Thank you very much, Dr. Burgess. And with that, we have come to the end of today's virtual media conference. I would like to thank today's presenters, Dr. Hines, Dr. Burgess, and Dr. Mohammed. Our media representatives, thank you very much. And you, our viewing and listening public, thank you for being part of today's COVID-19 update. Remember that we all have an important role to play in protecting Trinidad and Tobago from COVID-19. Keep making the responsible decision to follow the health guidelines, and please, let's vaccinate Trinidad and Tobago.
The Hot Zone.
My name is Dexter Saunders, and we're here at the Covert Hospital. We're actually on the floor of ICU HDU. We'd really prefer not to ever see you guys here. We'd prefer to see you guys on the outside, getting vaccinated, because here is serious business. People die here. It's not easy. Seeing and hearing mothers crying, fathers crying, even some of my colleagues. They call us the frontline workers. This is a wartime term. The war is being fought right here. And the only weapon we have in this war is vaccination.
Don't delay. Get vaccinated today.